All right. Well, good afternoon and welcome to the third in our series of online presentations, Conversations with the Life Raft Group, Meet the GIST Mentors. My name is Diana Neves and I am the Senior Director of Outreach and Engagement here at the Life Raft Group. And I will be your moderator for today's conversation, which will focus on meeting some of our GIST mentors. Today, I have the honor of introducing Santy Disabatino, Rob Taylor, and Marlene Nei. All three members of the panel have been either a patient or a caregiver of the month. They are long-time members of the LRG, part of the patient registry, and have completed the GIST 101 training. They have knowledge of their own or their loved one's GIST. They have experience with a GIST specialist and are advocates of their own care or that of their loved one. They are empathetic to other GISTers and their caregivers. They have practiced great self-care. And these GIST mentors are passionate volunteers, and I'm so grateful to them for joining us today. Each of them will share their GIST journey and why they chose to be a GIST mentor. You will also learn what's in it for you if you make the decision to connect with a GIST mentor. After the panel discussion, we will accept questions from the audience, which I will moderate. You can ask questions during the presentation by using the Q&A feature at the bottom of your screen. Click on the Q&A icon and type in your question, which we will answer during the last 15 minutes of the presentation. If you have any medical or science-related questions, we will direct them to our patient registry who will answer them after the end of this broadcast. So now allow me to turn it over to you, Santy.
Thank you, Diana. Good morning, everyone, and good afternoon, according to which part of the United States or the world you're living in. My name is Santy Disabatino. I reside outside of Greenville, South Carolina. I'm going to start with my journey beginning back in January, well, actually in July of 2017. I began experiencing some stomach-related issues and had some very dull, achy pains in my stomach area. My general practitioner at the time thought it was gallbladder related. He had a couple gallbladder tests done, a MRI on my gallbladder and another type of gallbladder test to see what it was functioning at. And those results came back low, but not necessarily that it would pinpoint what was wrong with me. He then sent me to a surgeon that he had sent his mother to for the same type of symptoms. In discussing things with the surgeon felt that after reviewing my tests, that he was not willing to take out my gallbladder at the time, and that was in January of 2018. So at that time, I asked him if he does colonoscopies, because I was due in February of 18 for my 10-year colonoscopy, and he said he does colonoscopies. And if anyone knew my personality, they would understand when I asked him the next question was, could he do a 2-for-1 and also look down my throat and do an endoscopy? And he said he would do that. The next thing I knew, I had both scheduled. I was in the in-out hospital surgical suite. He did both. And when he was done and I was in the recovery room, he came in and told me that I had an infection in my small intestine, diverticulitis, and that he prescribed 2 antibiotics for me that should clear that up, and my stomach issue should go away in 10 days. And then he also told me that I had a GIST. With that being said, he pretty much just said, my office will call you sometime next week and we'll follow up with another endoscopy in 6 months. He did not explain to me what a GIST was. So in my mind, I thought maybe a GIST could be some type of ulcer or something like that. I was very alert on the ride home. I immediately got out my iPhone and Googled GIST, and that's when it first hit me that I had cancer. It was quite a bang in the head when you first find out you have cancer. I'm sure it is for all of us. And not knowing what it just was, my first thought was, well, maybe it's something that's benign, and it's a benign type of tumor. Then as I read more, I found out that it could be benign or malignant. And I knew then, after when I follow up with my general practitioner, that more testing would be done. When I did get home that day in January, I immediately got on the internet and Googled just, from my laptop, and found out more information. And at that time, found out about the Life Raft group and immediately joined the Life Raft group. And they welcomed me with open arms that day. And I still remember the call I had with Laura that day, welcoming me to the group, and how much that meant to me and how important that was to me. So as time went on, I had a needle biopsy in April of 2018, and that confirmed that it was a GIST, and it also confirmed the mitotic rate. And from there, a week later, when my gastroenterologist called me with those results, he told me that if I were his father, that he would be recommending me to have it taken out immediately. My GIST was only about 1.8 centimeters in size. So then the next day, his nurse called me and told me that he had consulted with the surgeon that first found the GIST, and they both agreed to do watchful waiting for a year, and for me to come back in a year, and then they'll scope me to see if it's gotten bigger. That's when I learned, and I'm hoping too that as mentors, we promote this with the people that we are mentoring, and for everyone out there, that at some point in time, you need to advocate for yourself, because that is very important, because if you don't, nobody else will advocate for you. And at that time, that's when I made the decision to advocate for myself. And thank goodness for the Life Raft group, because unbeknownst to me at the time, on their within their patient registry and on their website for physicians right in Greenville, South Carolina, there was a surgeon that was GIST surgeon recommended, and there was also a GIST oncologist. I made the appointment with the GIST surgeon, and that was in the beginning of April. And by April 30th, I had my GIST removed outside my stomach. It was 1.8 by 2 centimeters, but I wanted it out. I didn't want to wait for watchful waiting for a year to see how big it could grow. I have a mitotic rate of 7, and I am exon 11, so I am currently taking 400 milligrams of imatinib daily. Once I was done with all my surgery and recovery, I decided to look further into the Life Raft group, and that's when I became acquainted with the outreach page and volunteering. And I just wondered what I could do to volunteer. And I noticed that I checked off these places where I would prefer to volunteer, but I also had written in to Diana about something that I felt that could be a missing piece to the puzzle, and that was to start a mentoring program for other people that were going to be diagnosed with GIST, and diagnosed with GIST in the beginning when it really hits you hard and you have 1,000 questions about the disease and what ifs, and no guidance and nobody really there to help you, especially sometimes in places where you don't have the availability of seeing a GIST specialist, but you're seeing a regular oncologist that may not know much about GIST. So I think that's one of the important parts of the mentoring program and why it was founded, so that we can help other people and give some advice and help lead people in the right direction so that they can advocate for themselves, that they can help find a GIST specialist, or that we can even give them advice on who to talk to at the Life Raft group if they're having issues when they are first put on medication, or they're getting ready to have surgery, or their oncologist is not a specialist, and what can they do and who can they talk to. So those are all very important things that I think that the mentoring program was founded for. so that we are there for anybody and anybody that comes along. Currently, there are 9 of us. There are 8 mentors for people that have GIST, and there's 1 mentor for anyone that's a caregiver. We have approximately 60 people that we help mentor right now, and we would love for the list to grow even bigger. I know it's tough at first because when and I found that out myself, as you heard when I first started talking about getting on and Googling GIST, and now you're getting all kinds of information. And I can still remember when I found out my mitotic rate, I even Googled GIST stages, and I found 2 or 3 different charts. And I guess I was hoping for that crystal ball that would say, oh, a mitotic rate of 7/50 is nothing to worry about. Don't worry about that. So, that's always out there and always on my mind. And sometimes I Google 2-3 times a week looking to see if there's any more updates in regard to care for GIST, new drugs that are out there, or any surgical procedures or anything else that may be out there that are new and they're advancing, because it seems like every year there seems to be more advancements with GIST. Other than that, Diana, I'm going to go ahead and send it back to you. And I want to appreciate everybody for being here today to listen to us.
Thank you so much, Santy. Now over to you, Rob.
You unmute myself. Okay, I'm Rob Taylor, and in 2016, I became 60 years of age, and so I went for a colonoscopy. So I had to go to a doctor, right? So I went to the doctor and said, hey, schedule me for a colonoscopy. And my doctor wasn't in, so I had to go to another doctor who was in the office. So she said, well, okay, well, let me give you a physical first. And I'm like, this woman is wasting her time, because I was boxing and I was in the gym, and I'm like, okay, hurry up, get this physical done so you can give me refer me for a colonoscopy. So she felt my stomach and she said, I feel something in your stomach. I need you to take a CT scan. I'm like, okay, whatever. All right. So I went for the CT scan. The day that I went to CT scan, I went to work and had a pain in my side, eventually passed out. I passed out. They called the ambulance. Ambulance wanted to take me to the doctor. I told them, forget about it. I got up in my truck, took my own self to the hospital. And when I got there, they had the results of the CT scan, and they found a tumor in my stomach, and they had to remove it. So this doctor with fingers the size of my arm said he's going to remove he's going to operate on me. I'm like, how's he going to get these big hands in my stomach? So anyway, he couldn't remove it all. He removed, it was 11 centimeter tumor. He might have removed, I don't know, 5 centimeters. So I went to another doctor, a specialist, to get the rest of it out. He couldn't remove it either, because it's wrapped around my a vein that pumps blood back to my heart. So he couldn't remove it. They said that it was a wild type tumor, and I was going to an oncologist that knew nothing about GIST. She sent me to another she admitted she knew nothing. She sent me to an oncologist who said he knew everything but knew nothing. And he gave me he said, well, I tell you what, we got you on 400 milligrams of imatinib. We're going to take you off the 400 milligrams of imatinib, but I want to give you some numbers. The average person in your situation will only live 9 months. And I'm like, wait a minute, hold up, wait. I tell you what, let's increase the imatinib to 800, because I didn't know. I was, even though I'm wild type and imatinib doesn't affect wild type tumors, I didn't know any better. I'm like, okay, if 400 don't work, let's go to 800, because 9 months to live is not good, of course, So I was going back from the surgeon, my oncologist, one oncologist, and another oncologist. They were doing CT scans, and each one of them had a different story. The tumor's growing, the tumor's not growing, they all had different information. And I was screwed up because it would be a high and a low, happy, sad. I was screwed up, and I went to my oncologist. One of my oncologists said, "Look, I need to get some pills or something because I'm about to go nuts." And she recommended that I join a support group. So that's when I looked up Life Raft Group. Looked up Life Raft Group, met Jim Hughes. Jim Hughes just was a blessing. He just laid information on me to help me out, to get me straight, to get me where I need to be thinking at, and information that I needed about just that I didn't have. And at the time, I did not have a mutation report, and I was still getting bad information from these doctors. So I got an opportunity to go to ASCO meeting, and I met Sarah and Laura, and Jim was there, and they were like working like mad to try to get things done, meet with people. They were so passionate about what they were doing to help people. And I was watching them, and I'm like, these people are they're committed. They're serious in helping people. And it really impacted me. And then they helped me and directed me to Dr. Trent down in Miami. And I got to meet Dr. Trent. I got to meet, him, talk to me for a while, went to see him, got my mutational testing done, got all the stuff I needed done, got some direction and some and understanding about GIST. And what had happened prior to that, I had read all the publications about the different exons. I knew it all. I knew all the things about everything. And then when I got down to for the mutational testing, it said there was no known mutations. So I was kind of upset because I knew I had studied and got all the information, and I couldn't use it for myself. So anyway, after all this, meeting Sarah, Jim, Laura, and the way they were committed, the way they were passionate, and oh man, it broke my heart, you know. And so I said, you know what? I want to help somebody like they're helping me, you know. I want to. I don't want anybody to be screwed up like I was, where, where I got so much information and misinformation that it was depressing me and messing me up, you know. So I wanted to help out, you know. I don't want anybody to be like me, and I wanted to let someone feel what I felt when these people were helping me for no reason at all, because they were compassionate and they were passionate about what they do. So that's how I joined the mentor group. So the reason that it's a good thing to join the mentor group is because you don't know when you're going to need someone to talk to that understands what you're going through. You can talk to your cousin, your uncle, whoever it may be, and they're just going to listen. And they're not going to even understand what you're talking about, but they're just going to say, "Oh, okay, all right. Well, I'll pray for you," but they're not going to understand. They're not going to be able to go after what your problem is. And then there's periods of discomfort, that things that you're not comfortable about talking about. You're not going to call your uncle and talk to him about diarrhea, but you'll talk to another mentor or another person that has GIST, that's been through this diarrhea problem and all the issues that you've been through. And if you haven't been through it, or if I haven't been through it, I know somebody that has been through it, and I can direct you to LRG or whatever it may be. So it's important. They say it's better to have something and don't need it than to need something and don't have it. So this is another tool in your toolbox in dealing with the complexities of having gist. And so if you have it, if you have this opportunity to have someone, they're not going to bug you and call you every 5 minutes. No. But when you need something, you'll be able to pick up that phone and say, I need to talk to you. I need to talk about this. I have my other mentors that's in this group that if I need something, if I'm going through something, I can pick up the phone, give them a call and say, look, I'm going nuts. I need to talk to you, because you want to talk to somebody that is sober minded at the time, because you will get to a point to where at the moment you're not sober minded, and you need to talk to someone that is sober minded, that understands what you're going through, that can get you back on track. Your uncle's not going to get you back on track, but the person that has that gist, has been through it, can get you back on track, and then you'll be okay, and then you can continue. So that's why it's important to get a gist mentor, because like I said, it's better to have it and don't need it than to need it and don't have it. And Diana, leave it back to you.
Thank you so much, Rob, for sharing your story. Now over to you, Marlene.
Well, good afternoon, everyone. I'm Marlene Nei, and I am a GIST caregiver mentor. My husband, Bill, is the GIST patient, and I'd like to give you a little background and tell you our story. This November, it will be 10 years. Bill actually was totally asymptomatic. The 2 days prior to his diagnosis, he and our son were golfing together, so he had absolutely no symptoms. He was going to our primary doctor for one reason only, which was to renew his scripts, which he had to do every 6 months. That was the way to get him to go for an exam for anything. And when he got to the primary, who happens to be a personal friend of ours, he said to Bill, why is your belly so big? And I used to call Bill Buddha belly, because he had this gigantic belly. He looked like he was 13 months pregnant, but yet he had little chicken arms and legs. Nothing was fat on him other than this humongous belly. So he examined Bill, and what he did was he told Bill he thought he had a hernia, which he didn't think at all. And he told him to go on over to the local hospital, and that he was going to send over the request for a CT scan. The doctor then called me at my new job that I had actually started 4 days prior. And he told me that he thought the results would come back saying Bill had a very large mass and that he needed surgery. So I then hung up the phone and queried by the way, we lived in Illinois at the time in a suburb. We're now in Wisconsin, southern part of Wisconsin. So I queried who in the Illinois area, what hospital would be the best, what surgeon would be the best for an intestinal large, or well, not large, I didn't know at the time, an intestinal mass. And one of the three came up as being University of Chicago. I didn't know anyone at University of Chicago. I also have medical experience. And I didn't know the other two hospitals, didn't know anyone there either. So I decided, well, I'm going to work on this. So I walked into my boss to tell him that I was going to have to leave my new job because this was now becoming what I needed to do, finding the right place, the right person to do the surgery. I went in and he was my immediate boss. It was a very small company. Prior to being hired, I had met for a half an hour with the owner, who, when I did start the job, the owner was out of the country. My boss said, well, why don't you talk to the owner? And I thought, why do I have to tell the owner I'm quitting? I mean, my job is not as one of the executives. And he said, you might want to go in and talk to him. And I said, well, he's out of town, isn't he? No, he got back this morning. So I walked into his office. I excused myself. I quickly said, I've just found out that my husband has a mass in his abdominal area, and I need to find the right place, the right surgeon. And he turned away from me, went to his keyboard, and I thought, well, that's how impressed he is. And a minute later, he turned back to me and he said, I just emailed the president of the hospital that I'm on the board on, which just happened to be University of Chicago. And long story short, from there, 4 days later, my husband went in for surgery by the most wonderful surgeon. And the day before surgery, we went there, we had sent all of his labs and scans, and he told us this is a GIST. Had no idea what a GIST was. All he said was to my husband, if you were my father, I would definitely recommend surgery. And I will tell you that if you tell me to go ahead with the surgery and I open you up and I find that I cannot take the mass out intact, I will close you up. The only other thing he said was, if you've not had a serious conversation about what you want done if things do not go well, I would suggest that tonight at the hotel we've placed you in, because it's too far for you to go back home, you have that conversation. The next day, we were back there at 5 in the morning. Bill's surgery lasted 8.5 hours. There were the primary surgeon and 2 other surgeons, along with whomever else. And he was able to remove the mass intact. It was a little bit larger than a soccer ball. And I did get to see it in person because he walked it down to pathology himself and he asked me to meet him. So it was out. We really didn't know anything at the time, or I didn't know anything. Bill was in ICU. And the surgeon then gave me the name of the Life Raft organization, telling me to contact them. And I thought, okay, you know, when we get home, I'll contact them. Well, Bill began having complications. He was bleeding out at one point. They had to take him back in, little of this, little of that. And then he got C. diff, which was not fun. So all in all, Bill ended up being on 6 different floors in the hospital. I think he went to every place but maternity and peds, and was in the hospital for several weeks. I never left the hospital. The only thing I did was call my son and ask him, can you do something about my cell phone? And the cell phone wasn't that old at the time. I said, it keeps telling me that I'm exceeding the data rate I have. And I was going online and I was calling, texting, doing everything. So I said, give me as much data as I can get. So of course he gave me unlimited data. And I started doing research, still hadn't called Life Raft Group because I was doing all of my research, find out what a GIST is, so forth and so on. When Bill was finally going to be released, I told the surgeon that one of the things I had seen online was that he had approximately 19 to 27 months. That was the on average for a GIST patient at the time. And he said, yeah, it is. He said, you know, but you never know. And I don't have a clock to tell you. But he said, that's the average. So I didn't know if I was supposed to look upon that and start a countdown, as I did when I was pregnant with my first child, that, okay, you're supposed to be born in 9 months. What happens? 9 months has passed. And what do I do now? So then when we got home, it took Bill months to recuperate. I was still doing all of my research. I wanted to find the right doctor, the right everything to help Bill and to help me to help Bill. And most likely I was looking for whatever it would be that would help me to fix Bill. I then contacted Life Raft Group, and I met the most wonderful, wonderful people there. In the staff at first, who helped me, who educated me, who held my hand, who mentored me. I then got on what was the pre-Gist Chat communication system. It was the listserv. I joined the listserv, and then I met, in addition to the staff people, I started meeting the Gist patients and Gist caregivers, and I learned from them. I queried. I was constantly asking questions. What about this? How do I that? Who do I whatever? I had fortunately been told by the surgeon that we should see the University of Chicago's Gist specialist, and was given her name. And we, as soon as Bill had recuperated enough, which his surgery was November 15th. It wasn't until mid-January that he was able to get out of bed really and was well enough to where we could go for our first appointment. I can't stress enough to you how much love I felt from everyone, not only at Life Raft, but those on and involved in Life Raft. And I also can't stress enough the importance of having a Gist specialist. And there's a codicil to that, because as we continued going to see our Gist specialist, and at that time it was every 3 months for lab scans and a visit, it became pretty obvious to me that it's very, very important for the patient as well as the family members to bond with your Gist specialist. If it doesn't feel good and right, then it isn't good and right for you, no matter what the credentials are of your specialist. You have to find the right one for all of you who are involved. It's a collaboration, it's a team effort. If your specialist does not want to collaborate or does not want to be questioned at all, then you need to look further. And that's been proven out not only for us personally, but as I've mentored other caregivers, that's been proven out. It's not anything I ever had to bring up or mention or would to anyone that I was mentoring, but it's been brought up to me. Oh, gee, we've got this Gist caregiver, and he or she just really, big ego and so forth and so on. I've heard it over the years. So that's when you say, you can always go online, you can look at the directory, or you can contact Life Raft, or I can go online with you. We can go through it, and you can see in your area what other specialists there are. And they should be very willing to work in collaboration with your local doctor, because many, many people will start out to me in my mentoring role saying, no, we don't have a specialist, but we absolutely love our primary. And he doesn't know, but he wants to research, he wants to look. And I jump at the chance to say at that point, work in conjunction with a specialist who will work with your primary, and your primary will be thrilled because look at the experience and the education your primary is getting. So I stress that you want a Gist specialist, and doesn't mean you have to give up the doctor you had for such a long time and you have great rapport and love with. Don't be afraid to ask questions. as Santy said, and Rob, it's great to be your own advocate. Everybody, however, does not have that advocate gene in them. My husband does not. I have met several other people who either their loved one who is the GIST patient doesn't have it, or they themselves, the patient, doesn't have it. My husband feels, oh, Mar's the one who can communicate. Mar can ask the questions. Mar. So I have found it very helpful to keep a log. I log any visits we go to, as far as not only the when, the how, the who, but what's being said, what we're told. Also, I always ask for copies of lab reports and a disc of the scan. And this is great because you want to send this over to the Life Raft group so that all of the information can be input and you get back a wonderful one-pager that's called a gistory. And you can put that in a binder, keep that. It's not 25 million pieces of paper and reports. It reads very legibly. Also, when you do go for your scans in your labs, or your loved one does, and you don't understand what all of this paperwork says, Life Raft is more than happy to walk through it with you, explain everything, mitotic rates, mutations, so forth and so on. Obviously, Bill, now going on 10 years, is well past his 19 to 27 months. We have found that we live a good life. There are many things he cannot do that we can no longer do together, that I know he misses, that I know I miss, but we still have many things that we can do together, separately, both with family, with friends. It's not the same life as before, but we haven't had to give up our lives. We've had to change certain things in our lives. Diarrhea and various hand-foot syndrome, different pains. You have to adapt. This is where the GIST Chat and Life Raft can help in many, many, many ways. Give you advice, direct you to different creams, this, that, whatever. But it's another outlet for you. All of this actually drove me to want to help others. I had been helped so very, very much in so many ways that I was very happy and am privileged to have become a caregiver mentor. And my definition of what mentoring means to me is, one, I'm not always needed. I'm there if you need me. I think ideally, like any support group, I wish there's no need ever for us to have support groups and mentoring groups. I hope someday the Life Raft organization can have a different avenue that they're taking, more with research for other facets, because I'm hoping, and I truly believe, someday there will be something that cures GIST patients. Look at how far we've come already in just the 10 years that I've been part of it. And I know since Gleevec came onto the picture, imatinib, we've come that much further in 20 years. I think it's very important to, as I said, be there for your mentee when they need you, when they want you. I also think in the same vein, it's very important to stay in contact with them, not to badger anybody. I will just send a quick email or text if I haven't heard from someone. and say, hi, was just thinking about you, letting you know I'm here if you want me and need me. And sometimes they call and say, oh my God, thank you so much. Other times it's everything's fine, everything's great. Don't worry about it. Nice to hear from you. So I believe I'm here to provide, when I can, emotional support to possibly help people who have hit that stone wall or are so frustrated because of something that's not working out well for them at the time, for their loved one at the time. I don't impose my will or my desire. I'm very careful with that. I know getting back to a specialist, that's the first thing I'll ask. Do you have a specialist? If I get a response, we love our primary, we're going to stick with that. I'll say, okay, that's fine. I said, but are you on the Gist chat? Do you want to just go on there, get registered? And as they start seeing, hearing people, hearing the different stories, we also had a webcam, a webcast rather, pardon me, and about a half a dozen Gist specialists were on it. One of my mentees heard one of the specialists and said, oh my God, he sounded wonderful. We're going to check into him. So, it's another avenue to learn to educate yourself. And if I am presented with something by one of my mentees and I don't know of any direction that I can put forth, first thing I'll do is ask them, do you want to contact Life Raft and see if they can direct you? It's very important to know that Life Raft and the people there are there for one reason, to help all of us. I don't know how they do it. They must not sleep, but they're there to help all of us. As a mentor, I know I enjoy communicating, or as Rob would tell you, I don't know when to shut up. My goal is to be able to impart any experiences or any knowledge that I may have gleaned or learned from so many others. And that's it. I am so grateful to all of you for dialing in and listening to my long-winded story. And I will tell you, we truly, truly are a family. Rob and Santy, along with the others, are my brothers and sisters. As Rob said, I can call, have called upon several of them. They've always been there to help, to listen, to love, to understand. And as a caregiver, it is different than a patient in the type of understanding, sometimes the type of support, because you're so busy as a caregiver asking about, well, what about this for my loved one? What about that? And people will turn around, friends, family, how's Bill? How's this? And it's like, what am I, chicken fat? So, and sometimes the caregiver thinks they're chicken fat and they don't think about their needs and wants. So it's really important to take care of yourself, because you can't be a good caregiver if you're not good to yourself. So thank you again. Back to you, Diana.
Thank you so much, Marlene, and thank you to each of you and sharing your very powerful stories. We do have some questions, so I will throw this first one out to you, Santy. Are you finding that you and other mentees are having the same issues or concerns during this COVID-19 pandemic?
Yes, I think that speaking on behalf of myself and some of the mentees that that I have, and also some of all the other mentors, there's we get very frustrated at times, especially in South Carolina. I know I do, because of the way the policies that have shifted as far as the coronavirus and the different stages of being able to go out and about and do the things we want to do. Typically, I'm masked wherever I go. But if I go out to the grocery store, if I go out to Home Depot or Lowe's, I'd say 75% of the people are not masked. It's a very fear I live with. I'm constantly putting hand sanitizer on my hands before I go in and right after I exit the stores. And it's just a scary situation. And it's always in the back of my mind because of the imatinib I'm taking and the chemo pill, and I'm at a higher risk. So it is a big worry for me. And then also being, so to speak, cooped up in the house all the time and not necessarily having somebody to talk to. It's good to be able to reach out to my fellow mentors or to just even text them or call them. And it can be very frustrating. It's a very rough time for everybody. And I think it's even a lot tougher for us, as a group too, because of, the type of medication we're taking and and how at risk we are if we contact something like this. So the fear is there.
Thank you, Santy. This one's for you, Rob. If I request a GIST mentor, how do you decide who I'll be paired with?
Well, I think that Santy does that. Santy,
Yes.
do you want to answer that, Santy?
Sure, Rob, I'd be glad to. What happens is we get the information from the Life Raft group on somebody that would like a GIST mentor. At that time, I look at the sheet that's given to me, and because of HIPAA law, the only information I'm really receiving is the person's name, their email address, their phone number, either email address or phone number. It doesn't have to be both. It can be one or the other if they prefer to be contacted via email instead of over the phone, or vice versa. And I'll also get the city or the area and the state they reside in, because I try to pair everyone up with somebody that's in that same time zone so they can communicate that much more effectively, because they would be in the same time zone. And I try to stay away from having a mentor that resides in California assign a mentee that resides, let's say, in Philadelphia, Pennsylvania, where there's a 3-hour time difference, and that mentee may want to talk to somebody at 9 o'clock in the morning, and in California it's only 6 a.m. So that's how I try to decide who is paired with who. We do not go into what exon you are, what type of GIST you have, because that's something under HIPAA law we cannot do. But if the mentor and mentee talk those things out, then they have some common ground, and they know, what type of possible exon, if you're on any certain type of drug. And in that case, sometimes it could be a situation where if someone is a wild type and the mentor I've assigned to them feels comfortable maybe calling Rob, because maybe Rob could help out with that person a little more because of Rob's certain type of GIST, then we do those kind of things, and we do tag team with each other as mentors.
Thank you, Santy. I am coming back to you, Rob. How do I know if I need a GIST mentor?
I was trying to think of a quote, but because you asked the question might mean that you do need one. The reason that, or the indications, is that I'm of the opinion that anyone that has GIST that it's on any type of treatment to where they're not NED and been NED for 10 years and everything is okay, then they would need a GIST mentor, because of the uncertainty that they have to go through, because you don't know what's around the corner. Something can happen and then you need someone to talk to, and then you need information. If you've been NED for the last 10 years and everything's been okay, then maybe not. But if you're going through the battle, if you're fighting this thing, then you would need someone that you can contact quickly, that can help you get over the hump that you're dealing with. Also, someone that will contact you, that is concerned about you, and especially if you're by yourself. Even if you're NED for the last 10 years, if you're by yourself, you don't have maybe a significant other, don't have anyone to, you know, to talk to and things like that, then you would need a just mentor, just to get you through, and so you won't be by yourself. It's bad being alone. So
Excellent. Thank
if
you,
you're
Rob.
fighting, then you need a just mentor.
Thank you, Rob. Excellent. Marlene, I'm a little on the quiet side. Is it okay if I prefer to chat via email rather than by phone?
It certainly is. When Santy assigns a mentee to me, what I do, and again, this is the way I do it, I send, if I have an email address, which I usually have, I will send a quick email. Santy notifies the mentee who their mentor is, gives them my name. So they're expecting a call from me or an email. So I will shoot them an email, introduce myself, give them all of my contact information, my cell phone number, let them know they can text me, they can email me, ask them if they prefer talking on the phone, texting, email, is there a particular time? And then I just quickly say, I'd love it if you want me to call you or you to contact me, but I'd love to hear your story to start out. And we go from there. And I've been so fortunate. I've been able to have relationships with several people, and we're close. We're friends. And other people, as I said, I rarely hear from them or hear from them saying, no, everything is fine. So whatever one is comfortable with, that's why we're here.
Thank you, Marlene.
You're welcome.
Someone just asked, how can I send my paperwork to the LifeRef group? Is there an email? I'm putting that email address in the chat box, and it is patient registry department at liferefgroup.org. So if you have any paperwork, you can send it directly there. The next question is, and this is for Santy and Rob, how long have you been on your medications?
I've been on my medication for, this is my 2-year anniversary that I've been on 400 milligrams of imatinib.
I was on 400 milligrams of imatinib for maybe 6 months. And then when the guy gave me 9 months to live, I went on 800 and was on 800 for about 2 years. And because I'm wild type, imatinib doesn't really inhibit the growth of the tumor. There was some more growth. So now I'm on something called selumetinib, which is a drug that inhibits NF1 tumors. So it's a long story, so I don't want to get into the long story, but because I have no known mutation, and NF1 is such a big gene, the thought is that there's a high possibility that's in NF1. So that's why I'm on selumetinib, and I've been on there for about a month and a half.
Thank you both. Santy, about how many mentees do each of the mentors mentee?
The average is typically right now between 5 and 8. When we met in November, we all agreed that 10 would be the maximum for any mentor to mentee anybody. 10 people would be the maximum. And right now, the average is between 5 and 8 that we're mentoring. It varies from person to person. We have a fantastic person in California that I believe is mentoring 8 or 9 people, because there's that many in California or on the West Coast. So it's easier for her to contact and stay in contact with them, as an example.
Thank you, Santy. Marlene,
Yes.
for a caregiver, what self-care tips would you offer, if you can give one or two?
I would suggest that you take, I don't care if it's 15 minutes of alone time. I don't care if that's going in the washroom, getting in the bathtub. Ideally, if you can get outside, go for a walk, exercise. There are a million videos you can look online for various exercises. Do yard work, read. It can be a book, a magazine, anything that you can do for yourself. Yoga is wonderful. Just even meditate, just take deep breaths for 5 minutes. Right now with the pandemic, obviously, we're not able to see friends, not able to get out to go to clubs, so forth and so on. But there are enough things that one can do for themselves to just take that time.
Excellent. Thank you.
You're welcome.
I'll throw this out to Santy. When is the best time of day to take Gleevec, and which type of food should you take it with?
That, I think that varies for everybody. I've seen people take that when I first started, like Marlene mentioned listserv, there were a lot of people that would respond then. Some people take in the morning with their breakfast, some in the afternoon, some in the evening, and some before they go to bed with some crackers. I think the important thing, other than when you want to take it, you have to find your own common ground on how you feel after you take it. And sometimes it takes some testing on when you feel you can take it. I personally take it right after my dinner, because I think my stomach's full then, and it maybe can be tolerated more. Than I have not had any reactions by doing it that way. So from day one, I've just always done that. And sometimes not so much now with the coronavirus, but on a Friday or Saturday, we would go out to eat with friends or just go out to dinner. And I bought one of those little pill cylinders, I'll call it, that you can screw on and screw off from your keychain, and you can screw the cylinder off. And I put the Gleevec in there so that when I'm at dinner, when I'm done with my dinner, I can take it. I think the other important thing I would stress when taking any type of or just drugs is that you drink at least 8 full glasses of water a day to stay hydrated. Me, myself, I average between 80 and 90 ounces a day, but at least drink 8. I think as somebody once said, drink 2 liters of water a day, which is equal to a nice 2-liter size Coke or Pepsi container. So I would highly recommend it if somebody's not doing that, to make sure they drink at least 8 ounces of water a day. I mean, eight glasses of 8 ounces of water a day.
Thank you, Santy.
Yeah.
For Rob, what is the typical length of time that you stay connected with your mentee? 6 months, a year, longer?
I stayed with mine since I had started contact with them. So it's forever, because, well, I shouldn't say, well, it's forever. See them through, and until they would say that, they would have to indicate to me that, hey, I'm okay, I don't need a mentor. But I stick with them. I'm not giving up unless they give up, and I'm still not going to give up. I'm still going to email them if they do give up. So it's a lifelong thing, lifelong journey.
Thank you, Rob. Marlene, if a mentee asks for a specialist recommendation, how do you handle that?
If they ask for a specialist recommendation, I ask them if they've gone on to the list, to the LRG directory of specialists and look through it. And if they say yes, but they're not sure which one is the best, I give them a couple of suggestions. I ask them if they've thrown it out on Just Chat to ask for the patient's recommendations, or why don't they contact, I give them your name and ask them to contact you. I also offer, would you like me to shoot an email to Diana just to let her know you would like her to contact you as to a recommendation for a GIST specialist. I've also, they've asked me, two of my mentees, to go onto the directory and show them how to use the directory so that they could look through it because they'd never been on it before. So those are the various options that I've used.
Thank you, Marlene. If one is considering becoming a mentor, what is the process, Santy?
There's a form that's filled out through the Life Laugh group, or you can contact Diana at the Life Laugh group, and then she would be discussing the role of the mentor with you and asking you some questions that she has set up to make sure that you would be approved to become a mentor. And then once you're approved to become a mentor, then she would forward your name to me, and then I would get in contact with you.
Thank you, Santy. And there's one more question here. Are there any support groups at the Life Raft group if I want more than a mentor? We do offer support group led by or co-facilitated by social workers. And that information you can find on our website. It is under our events tab. There are two currently going on right now. They're full, but we do plan to continue to offer those. So definitely stay tuned. We will post more information on our websites and on an email and put it on Just Chat. And I see one more question, and that will be the last question for today. I am a 32-year-old who just completed, I have advice. I share with patient, but at the same time, I'd like to have. Yes, so the person that just sent in this question, they want to become a mentor themselves, but want to work with a mentor. So they want to have a dual process here. So working with a mentor and becoming a mentor. Would you like to answer that question, Santy?
Sure, I think, yes, they can do both. Without a doubt, they can do both. I can understand where they're at right now because I've already begun some discussions with my specialist on what we feel we want to do when I get to the 3-year mark on the imatinib with the mitotic rate I have. And those are discussions that it would be great if I can share them with someone else that's in the same type of situation with me, or that's approaching that point, or that is at 3 years, and what their plans are, because it helps to hear from other people that are feeling the same things or going through the same things as you, and to discuss them with you. And at the same time, knowing that you want to become a mentor is important too, because you have a lot of history that you can share with others to help others.
Thank you, Santy. And if there are any other questions, please don't hesitate to reach out to me. I am putting my email address in the chat, and it's dneves@liferaftgroup.org. I'll be sure to share any of your questions with the GIST mentors if you'd like to direct a question to them. Be happy to do that. Thank you so much for sharing your stories with us, Santy, Rob, and Marlene. I can't thank you enough. We so appreciate you and all that you do for our GIST community. You guys are rock stars, along with the other GIST mentors. I'm really excited to be working with you all, and it's such a pleasure. And I know your mentees are very grateful because I receive testimonials all the time and just positive feedback from them about their work with you. So we are out of time today. So if you'd like a GIST mentor, please visit our website under Get Support for the GIST Mentor Program page. Also, please join us for our GIST Watch Read event and our GIST Mindfulness series. These events, along with other events, can be found on our website under the Events tab. So thank you, everyone. Stay safe and stay healthy. And until next time, have a wonderful day.
Thank you, Diana.
Thank you.
Thank you.
Thank you, Diana.
Thank you,
Bye-bye.
Marlene and Rob. Take care, guys.
All right, take care.
Guys.